Hi, I'm Dr. Schneider from Schneider LASIK Centers. Welcome. Right now we're standing outside the building. We're going to do a little brief office tour to get you kind of acquainted with our center. So I'd like to invite you, come on inside. Welcome to our lobby. Once you arrive here and after checking in with the receptionist, our next step is to take you into our pre-test area. Go ahead and grab a coffee or something to drink and follow me and I'll meet you there. Now we're in our pre-test area. This is where we start the examination process to determine if you're a good candidate for laser vision correction. We do a variety of tests here. The first test we do over here is what's called an auto-refraction. This device automatically determines the prescription of your eyes, and we compare that with your glasses to see if there's any difference. Next, we bring you over to the corneal topography unit, which is to measure the curvature of the cornea. And then we also check the status of your tear glands to make sure you don't have any dry eyes. Next, we move on to what's called the HD analyzer. And this can pick up on early cataracts that we normally can't see during routine examination. And then lastly, we have what's called the wave scan, which is basically a fingerprint of your visual system. We also use this to help program the laser to provide your treatment. Now that we've completed the preliminary testing, our next step is to go into one of the exam rooms and look at the eyes under the microscope. Come on in. Now, any of you who've had your eyes checked, which I'm sure all of you had, otherwise you wouldn't be here, recognizes what this room is. This is a chair you sit in, and then this is what's called the phoropter. This is that famous test, which is better, 1 or 2. Again, we'll use this to refine the prescription and compare it to the readings that we got on the outside. Then we'll look at you with the slit lamp microscope, and with this we look at the health of the cornea and to determine that there's no scar tissue or anything that's going to interfere with a perfect result. After this is done, we do some other scanning of the back of the eye to make sure the retina and optic nerve are healthy. This is the patient counseling room. So after we've determined that the procedure is a good fit for you and you want to move forward, we have you meet here with one of our vision care counselors where we go over the details, what's going to happen on the day of the procedure, financing, and those type of things. Next, I'm going to take you out into the laser room where we actually make the magic happen. We're about to enter the laser room where the magic happens, but before you get to go in, you get to put on this lovely hat. Follow me in. As we enter the room, you'll walk around here, you'll take a seat on the chair, and then lie down. And I'll walk around here. We'll put some numbing drops in your eyes. So they sting a little bit when they first start, but after that, it completely numbs the eye and you should feel no pain or discomfort whatsoever. Now, the first laser that we're going to use is called the interlace laser, or the IFS laser. And what we do, we use that laser to make the flap of the cornea. And what we do to do that, we have to couple it with a silicone device which goes on the eye. You'll feel a little bit of pressure, and then this device attaches to the laser and then couples with this device, and the flap is done in about 10 or 15 seconds. After the flap is done in both eyes, you swing the chair over and we do the reshaping of your eye with the excimer laser. Depending on your prescription, it may take anywhere from 2 seconds to 30 seconds. We sit you up, you see better than you saw before, we take you to our recovery area.